Hi, good afternoon, good evening. I hope you're all doing well. And thanks for joining me again. Today, we're going to look at a very important topic. We're going to be looking at health disparities. And specifically, we're going to focus on policy impacts and how these are influential in terms of health, well being, and populations. So, this conversation is really about how health disparities exist and social determinants that lead to and can also help us to develop policies. And in that way, we can better understand how policies are impacting the development of programs related to healthcare and well being for not just those that are marginalized, but for our society in the United States. Health is obviously very, very key and important, and it is vitally important that we understand these impacts of healthcare. So, we're going to start off with a few definitions and concepts here that are important. We're going to talk about what are health and healthcare disparities, and we'll talk about why this even matters. Why should we be concerned about healthcare disparities in the and what is the current status of the disparities? And we will then finally look at some key initiatives, policies that have been developed to look at healthcare and disparities in the United States. And I'm going to also focus on the determinants, the social determinants for health, which are vitally important. We'll spend some time to focus on that as well too. And to wrap it up, as a conclusion, we will discuss initiatives, policies for mitigating, managing the healthcare disparities that we have, unfortunately, in the United States. So, let's start off a little bit with what is health and healthcare disparities. And I'm going to move the microphone up a little bit here, see if it can probably help with picking up some of the sound. And I want to make sure that you all are able to hear this and that you have access to the information. It's obviously important that you hear it. So let's look at in terms of health and healthcare disparities. Health and healthcare disparities refer to differences in health and health care between groups that are closely linked, that are similar in terms of socio-economic and or environmental disadvantages. So disparities occur across many dimensions, including race, ethnicity, socioeconomic status, age, location, gender, disability status, sexual orientation, etc. So we have to back up a little bit and understand that in our society, we have a finite number of resources, and these finite number of resources include that of health and healthcare access. And so, healthcare disparities exist, unfortunately, in our society, as they do in other societies. Uh, what is important to understand, though, are the mechanisms that create these healthcare disparities. And we then go to the question of why does it matter? Why should we be concerned about disparities that others may face in terms of health and healthcare? Well, because there are finite resources, we ourselves, individually as a person, will at one point or another face this lack of resources for ourselves or a loved one, someone we care for, will come across these disparities. And so it is important to understand how these disparities have existed and what it means in terms of policies and program development to strengthen, to help eliminate, mitigate some of those disparities. So, why is it important that we understand these disparities? It's important because our population is becoming more and more diverse. That seems like an obvious, but particularly here in Los Angeles County, we have a very diverse and growing population that includes largely those that were once thought to be quote unquote minority communities are now the majority communities, specifically Mexican American, Hispanic Americans, South Americans, Central Americans constitute the largest population in Los Angeles County, and they are growing. And we know that people of color account for over half, 52% of the population will account for over half of the population in 2050. So in 30 years from now, over half of our population will be people of color. And so we need to understand these health and social determinants. We'll talk about why race is one piece of social determinant. Ethnicity is also another piece. But it's important for us to understand this because we are, as social service providers, as healthcare providers, going to be working with these populations. And so it's important for us to understand the impacts that they face. So, what are some of the healthcare disparities that we have currently? Um, we need to go back a bit in time to talk about the Affordable Care Act and to understand that the Affordable Care Act was not a universal healthcare plan. The Affordable Care Act was not a universal healthcare plan. It was a health insurance expansion program. It was a health insurance expansion program. So the current state of disparities at this point are that we still continue to have more uninsured individuals in the United States. For example, in 2018, Hispanics were 2.5 times more likely to be insured than whites. So Hispanics were 19% uninsured overall in terms of their population group, and among whites, Caucasians, 7.5%. Also, what's very important economically, socioeconomically, is individuals with incomes below the poverty line are 4 times as likely to lack coverage than those with incomes at 400% above the poverty line. So, individuals with lower incomes at the poverty level are 4 times more likely to be uninsured. That's a key health disparity. The socioeconomic status of someone creates this health disparity. And as we know, it can create limits to access to healthcare, preventative care, acute care from becoming chronic care, etc. So let's talk about some of the social determinants of health overall. There are 6 social determinants of health, and I'm going to go through these. Number 1 is economic stability, includes employment, income, expenses, debt, medical bills, and support. Economic stability, employment, income, expenses, debt, medical bills, and support. Some individuals might be working, they may be employed, but they may not have adequate health insurance coverage because they might be working 2, 3 part time employment situations where they may not get the total coverage that they might. So, again, the Affordable Care Act was health insurance expansion. It was not universal health care as some believed it to be. Income. We need to think about the expense to debt ratio, and we need to think about medical bills. As we all know, medical bills, if we experience a medical crisis or emergency, we may have to dig into reserves, savings. We might have to also think about how we make choices around our healthcare if our income, our substantial income, our consumer market, our basket of goods is impacted by having to decide between paying for rent or paying for medical care, medical bills. So income stability is very important. That's number 1 social determinant of health. Number 2, neighborhood and physical environment. Housing is absolutely key in this area. And I will be doing a future video on homelessness and housing. But housing is very much an important key to how we view healthcare, health determinants. So we have to understand that housing is a vital key piece of what helps to keep us well, keep us healthy. Housing, good housing, structurally sound, safe housing, housing that if we are living in a social service environment where we have wraparound services are important. If we're not, and we are lucky to have family or friends, those peer supports are also important in terms of housing as well too. So housing, neighborhood and physical environment, very key. Transportation, safety, parks, playgrounds, walkability, etc. Even geographic zip code has an impact on health, on the determinants of health. So number two was neighborhood and physical environment. Key there is housing. Number three, social determinant of health, education. Education. Studies show that the higher education level we attain, our health becomes better, can be better. Why? We might have access to networks, social networks that include options of access to healthcare. We might have peer groups, social networks that include access to healthcare through those social networks. That's important to understand. Literacy, language, vocational training, and higher education are all clumped into education as a social determinant of health. That was number three. Number four, food, nutrition. Many of our lower income families and those that have limited access to healthcare also do not have access to nutrition or healthy foods. We all know the impacts that having access to healthy foods has on us. And when that access is limited, we know how we can be impacted by living, for example, in what's called a food desert where there is not nutritious food available for somebody. And when we think about economic stability, the number one social determinant, we have to look at how people again have to choose between food and rent, support groups, support systems, community engagement, stress. These are all very important things. Social context, community immersion, community connectedness, community cohesion, very important key social determinant of health. Lastly, the sixth social determinant of health, the healthcare system itself. The healthcare system itself. Access to healthcare, quality of care, health coverage. Some individuals, families may have access to health insurance, but their coverage does not cover specifically what their needs might be. And so they may have the access to the health system setting, but may not have the adequate components of healthcare, medications, right treatments, efficacious treatments to help them sustain health. So let's review social determinants of health, economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system. Six social determinants of health, which then lead to health outcomes. These six social determinants lead to our health outcomes, our mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. So these social determinants of health, these six determinants of health, lead to healthcare outcomes. Mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. Now, let's look at some of the key initiatives to try to mitigate, to eliminate these healthcare disparities. So, major recognition of health and healthcare disparities began nearly 20 years ago. 20 years ago. There were two Surgeon General reports in the early 2000s that showed disparities in tobacco use and access to mental health services by race and ethnicity. So, nearly 2 decades ago, in terms of policy, there was this view, this approach that health disparities were impacting individuals in our societies, and there was a push to try to eliminate these health disparities. The first major legislation focused on reduction of disparities was the Minority Health and His Health Disparities Research and Education Act of 2000. The Minority Health and Health Disparities Research and Education Act of 2000 created the National Center for Minority Health and Health Disparities. So in the early 2000s, in 2000, we had the development of the National Center for Minority Health and Health Disparities to specifically look at these health disparities and trying to tackle these health disparities. Soon after, early 2000s, there were two very important reports that looked at race and ethnicity and disparities in healthcare in terms of access and quality of care. And you're welcome to Google these. Look under the National Center for Minority Health and Health Disparities, and look at health disparity reports that the Institute of Medicine released. These looked at specifically the impacts of race and ethnicity in terms of health disparities and for access to and quality of health care. So, there was a very important piece of legislation in the early 2000s. So, 20 years ago, we had this development. And we also have to think about the Affordable Care Act. And again, the Affordable Care Act was not universal health care, it was an expansion of health insurance for individuals. So, at the federal level, what policies have been developed? In 2011, Health and Human Services developed an action plan for eliminating racial and ethnic health disparities, which looked at the Healthy People 2020 goal. And you can Google this report, Healthy People 2020, through the Department of Health and Human Services, to see what are some of the efforts that are being developed. In 2013, Health and Human Services updated the national standards for culturally and linguistically appropriate services to ensure that people receive care in culturally and linguistically appropriate manners. Looking at language, looking at cultural responsiveness, cultural attunement, cultural competency. 2011, then later in 2013, the expansion of standards for providing care, which was culturally and linguistically, language-wise, aimed at reducing health disparities. In 2013, the Centers for Medicare and Medicaid Service released an equity plan for improving quality of care in Medicare. And in 2018, the Center for Medicare and Medicaid Services released a rural health setting strategy. So even though we have in the early 2000s, almost 2 decades ago, a little over 2 decades ago, this understanding, this sense that policy was way behind in terms of managing health disparities, it was not until 2018 in which we have a standardized rural health plan. So we have to think and understand and look at critically some of the policy impacts that happen in terms of health disparities. We discussed a few videos ago how we raise problems to that of the personal level to the consciousness of the nation. And the Affordable Care Act was very important in that dialogue, raising people's consciousness of the health disparities, making sure that our elected officials, that our community partners, that our communities were involved in looking at these health disparities in a way that was meaningful, that included program development and enhancements. So those are some of the ways, some of the policies in which there has been an aim towards mitigating, eliminating health disparities among individuals, minority groups. And we use that term loosely, minority groups, because as we discussed, what were minority groups are now majority groups. And so we really have to, again, look at the equity in terms of healthcare provision and services, healthcare access, and healthcare quality. The quality of healthcare is also important. The access to healthcare is also important. The way in which the healthcare is delivered is also important. Has to be done in a culturally sensitive, culturally component way. Those are all key. State, local communities, private organizations, and providers also focus on social factors influencing health. State actions to reduce disparities very considerably. In California, we have a very robust health system that looks at disparities, cultural difference, cultural similarities, language, ethnicity to try to engage. But we still have, through even though we have this robust system, we still have health disparities here in California and Los Angeles, LA County. Look at the transgendered community. We look at the health disparities among the transgendered community, and we see levels of violence, levels of access to healthcare, stigma, et cetera, et cetera. So even though we have a robust system, that system still is not able to provide quality care to everyone. Finite resource, finite resource. So why is it important to understand health care and healthcare disparities? We are all impacted by the health and well being of others. We are all impacted by the health and well being of others. So if we neglect as providers to focus on the health care of others, we are in turn neglecting ourselves. So it is not just it's that person's problem. It is our issue. It is our concern. The way in which we manage and look at and focus how we deal with individuals and how we greater provide access to healthcare, quality healthcare. What can we do as providers? Be attentive and tuned to the patient, the client, the consumer you're working with, and understanding their ethnic, racial, social determinants of health. Those 6 determinants of health that we discussed, be aware of those. Ask if you're not clear in terms of language. Ask if you're not clear in terms of culture, ethnicity, ways of doing things, rituals, alternative approaches to health, which may be congruent to ethnic and racial ways of treating disease and illness and promoting well being. Ask about those if you're not aware of them. And then be advocates, be policy advocates, be very clear that as a provider, and as an individual, we are impacted by the lack of access to healthcare. We are also impacted by the inability for ourselves to be advocates for others who don't have access to good quality healthcare. And really be passionate about how you engage within systems of care that you work with to look at those social determinants of health, the 6 determinants of health: economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system itself. For yourself, think about where you work in and how does the organization or agency or system that I'm currently in address health disparities? How can I, as a provider, look at those 6 social determinants of health with my patients, my consumers, my clients, and engage with them in a way that helps promote good, healthy outcomes, good health outcomes, good outcomes in terms of mortality, good outcomes in terms of morbidity, life expectancy, healthcare expenditure, reducing healthcare expenditures, health status, any functional limitations, so that these things are vitally key and focused on the individual you're working with being healthier. Because if we are able to keep our patients, clients, consumers healthy, we in turn also become healthy. It's as simple as that. And so, for us to be mindful of these determinants of health, for us to be mindful of the policies that impact determinants of health and health outcomes, and for us also to be advocates, clear and strong advocates around what is good, equitable healthcare is vitally important. Comment down below. Tell me what you think in terms of the social determinants of health and how you can improve those social determinants of health, thereby improving the health outcomes that people have. Thanks for joining me. Comment below. Have a great day. Peace, love, and wellness.